My name is Dr. and I'm very thrilled, excited, even nervous to be your Master of Ceremony for today. Welcome to an event that is absolutely unprecedented. You'll hear more about it in a minute. We would like to just, in terms of housekeeping, to inform a few things. One, according to the regulations of the Israeli Ministry of Health, we should all be with our masks on throughout this event, unless we are speaking or eating, and eating is outside. Second, please turn off your mobile phones so they will not distract you or the audience. I would like also to announce that towards the end of our meeting today, we are surprising the audience with a spontaneous event. It will be quick and short, and we call it the pitch of excellent ideas to combat COVID-19, and specifically in the issues and areas surrounding vaccination. So each one of you, unfortunately not the hundreds that are watching us live right now, as there is a live transmission to hundreds of Jewish, Muslim, Christian, Baha'i, and other organizations around the world through the good services of our colleagues here. But those who are in the audience may stand up and offer a 1-minute pitch of an idea that they've actually either practiced themselves or think of, or that would emerge as they will be listening to the presentations here today. Without further ado, I would like to start with a greeting that comes from the citizen number 1 of the State of Israel. President Herzog has apologized that though he is so close by, actually 200 meters from here, his schedule will not permit him to be here physically, but he had sent us, and it's in your folders, a personal letter of greeting to each and every one of you. And I would read for the audience watching us live abroad the English translation of the letter, which is relatively short, succinct, but very important. President Herzog writes to us, "Dear friends, at this time of crisis, we are learning about the importance of solidarity and mutual responsibility among the various communities in which we live, and the importance of contacts with others as well. For nearly 2 years since the outbreak of the new COVID-19, we have all experienced a new reality, a new world order, with unbelievable difficulties. But there are also rare opportunities for cooperation across borders, faith, and nations as part of improving our abilities to cope with the consequences of the pandemic. Among these collaborations," writes the President, "the great value of interfaith partnerships is very prominent. They can boost closer ties among people, bring down walls, and of course lead to joint action in dealing with these challenges. There is no doubt that in Israel, the Holy Land, and the spiritual center of humanity, leaders of faith have a much larger significance. So it is natural that from here, beneficial partnerships could and should be created. And this is expressed in your workshop today. This meeting is an opportunity to prove the importance of spiritual leadership in preserving and strengthening community and the continuity of communities, its powers versus the pandemic. And its implications are very significant and welcome. It is no secret that in Judaism, the connection between religion and health has deep roots, and that leaders of faith over the generations saw preservation of health as a supreme value. As a result, the leaders of Jewish communities are active with numerous organizations, initiatives, and aimed at strengthening the holiness and stressing the holiness of the ingravity in life. I wish to send to you, the organizers and the participants in this workshop, wishes of great success. I will," tells us the President, "that he will host at the President's residence at the end of the workshop today a very unusual meeting with senior heads of faith in Israel for a unique meeting to promote this important cooperation and to honor the religious leadership and its coping with the challenges of the pandemic. These are greetings from the President of the State of Israel to all of us and to all of you viewing us and being here. The Mayor of Jerusalem is also a great supporter of this initiative, and he had sent us a visualized greeting as he is currently exactly on a plane going abroad. Let's listen.
I look around the city, around the country, and even the whole world, and I ask myself, what has Corona done to us? It has taken so much from us. It has taken loved ones. It has taken away jobs for many. It took food off the table. It destroyed families. It took away our freedom. It took away our sense of security. It left us feeling scared, unsure, and with more questions than answers. But as much as Corona drove us apart, it also brought us together. It brought us the very best in so many people. We saw in Jerusalem how so many people went out of their way to help, to even save lives. We will look back at this difficult time, and above all, we will remember the dedication, the commitment, and the sacrifice of the nurses, doctors, and all the medical staff who were the soldiers on the front line of a war, which in Israel alone has claimed the lives of more than 8,000 people. And alongside them, so many faith and religious leaders from many different communities, Jewish, Christians, Muslims, and many more, who have also stepped forward and helped their communities carry this very difficult burden, keeping the torch of faith and hope burning brightly. Coronavirus did not discriminate between religions or color. It attacked all of humanity, and so all of the humanity must work together to face this challenge. Jerusalem is a symbol for so many believers all over the world. So it is very fitting you are having this important meeting here in the Eternal City. I want to thank everyone at the Jerusalem Impact Vaccination Initiative for bringing us all together today. And I'm sure that even after COVID is just a memory, the bridges you are building today will stay strong. Thank you, and kol hakavod.
Thank you to the Mayor of Jerusalem. And it now gives me a great pleasure to invite Rabbi Benny Lehman, who is the chair of the Falk Schlesinger Institute, one of the very few in this country that examine the relationship between the Jewish halacha and medicine. Professor Marin, who is the head general manager of Shaarei Tzedek, will join us a little bit later. Benny, please.
In the schedule, it should have been Rabbi Dr. Mordechai Halperin, who is the director of this institute. So I come instead. Well, the institute, the Falk Schlesinger Institute for Research between the cooperation between the Jewish law and medicine was really founded, I must admit, in behalf of my grandfather, who used to be the Director General of the Shaare Zedek Hospital, and the first director of the institute is sitting with us. And I remember when I was a very little child, about 10 years old, that the institute was founded. And the foundation of the institute really followed the line that my grandfather and the people who built up the Shaare Zedek Hospital felt that the cooperation between medical care and keeping the Jewish law is very simple. There is no contradiction between following the Jewish law or any religion and seeking the best medical care that one can get. And therefore, the Institute really did few things. The main thing was to find the way to go on with keeping the best medical care and the Jewish law, and to give some ethical guidelines, because a lot of the questions that arise while you're really preserving life, keeping life, and sometimes really accompanying people at the end of the life are very grave ethical issues, and there should be some guidelines, and the Institute really provided this along the years because of the work of the directors, Professor Steinberg and Rabbi Dr. Halperin. So when Dr. Shenkar came about and asked us to be a platform for all this project, we felt that he is really begging an open door, and that's why we joined in. And we feel very honored to be part of this initiation, and really supporting, and more than supporting, all the work that is done. So we feel very honored to be part of this, and we pray that it will work out, and the cooperation that is on the basics of our lives, because actually what the corona did for us is to remind us that we are all brothers. Sometimes we tend to forget, especially in this area of the world, and sometimes it gets, maybe God's give us a very hard lesson that we should come together, work together, feel again our brotherhood, and fight together with what is needed, what it takes to do in order to preserve life and forward our lives together. So, go on. Okay.
Thank you very much, Rabbi Lehman, and we are continuing with our program, happily, exactly on time. As I've said, the Director General of Shaare Zedek Hospital, Professor Marini, is on his way and will greet us when he arrives. Let me take us through the first presentation in the schedule in front of you. And begin with some thank yous. In front of you are the names of the organizing committee of this event, individuals that have spent the last couple of good weeks in preparing for this workshop, and I would allow you to read their names and their functions, but would really highlight the fact that the combination of wisdom coming from people who practice medicine, who are within the faith of their daily practice, and also from the Office of the President, have really allowed us to put together, I think, a very, very fine program, but this is for you to judge. I would also like very much to thank the co-sponsors of this event, which is, again, a combination of organizations that felt that this type of interfaith and intersectorial faith and public health initiative is worthwhile for them to participate actively and financially. So I would like to greatly thank the American Jewish Committee, the Shaare Zedek Hospital, the Falk Schlesinger Institute, and our colleagues at Impact Vaccination, all being the co-sponsors of this initiative. There is this famous line which we know from the Bible, and I think that to us today, the lower part of the slide that describes people of many faiths, and not just the ones practiced here in Jerusalem, is the message of us in Jerusalem reaching out to the world in a time of crisis. And the crisis is the COVID-19 initiative and the crisis around health and economics and social that we have all experienced. So what is the Jerusalem initiative called Jerusalem Impact Vaccination Initiative? It is a Jerusalem-based initiative. It has emerged as a civil society initiative together with the government. You see some of the logos of the initiative participants contributing in direction, contributing in the essence of their own expertise. For example, in the Ministry of Health, we are benefiting a lot from their IT section that is part of this initiative, as well as international organizations like the American Public Health Association, and we hope that soon also the World Health Organization, which I'll mention in a few minutes. The largest sick fund, or as we call healthcare services in Jerusalem, Meuchedet, is a key partner to this initiative, and we are very pleased to have senior representatives and many representatives of Meuchedet as a signal of their participation and their commitment to this initiative, which at the moment is striving to generate the best expertise in also providing technical assistance, as I will mention in a few minutes. The Israeli Medical Association is represented through the chairmanship of Professor Galia Rahav, and that's the infectious disease union of the Israeli Medical Association. And the American Public Health Association is partner to us, as you will hear, with Barbara Baylor towards the later part of this workshop, being an international entity based in the US that sees also great value in the collaboration between faith and public health. The School of Public Health at the Hadassah Medical Center is another partner to the initiative, and Dr. Ronit Calderon is currently viewing us from her office. The Jerusalem Impact Vaccination Initiative goal is ahead of you. It is actually trying to look at the scene around us and understand that very important bodies, from Pope Francis to other Christian denominations to other faiths, including the Islam medical associations around the world and Jewish organizations alike, have seen COVID-19 not just as a dramatic disease affecting their communities, but also as an opportunity to widen collaboration, to seek new avenues for interfaith and other collaborations. So our goal, based on the Jerusalem experience that has been gathered here over the last 2 years, and specifically since December of last year with the enormous effort in vaccinating a whole city with the harder to reach and the less harder to reach, that experience could be shared with others who are struggling today with the difficulties of actually setting up vaccination centers, creating demand, engaging communities, and the fact that we are able to tap to the junction between religion and public health, as we do in this workshop and beyond, is perhaps the unique characterization of what the Jerusalem Impact Vaccination Initiative is all about. Because Jerusalem is unique, because Jerusalem has the strength of not just being the center of the world to the Abrahamic religions, but also beyond, and for us being able to base our technical assistance work on very sound experience and expertise, much of it is placed in this room at this moment. We see in the world a very dramatic situation in which equity is an issue, but also technical assistance. Equity because, as you know well, there is a difficulty in getting enough vaccines to all people of the world eligible to be vaccinated. We call this manufacturer to port. But there is also another pain point, which we call port to arm. How, when countries are benefiting from vaccinations in their ports, airports or naval ports, how do they get the vaccines to the arm of individuals? And that is seeming to be something quite simple. Well, it's not, and anyone sitting here from Me'uchedet will tell you exactly why. So we are looking at the internal circle whereby we see the difficulties of what to prioritize. Countries that have the infrastructure, the know-how, the collaboration in order to not just receive vaccinations and get them properly to the arm of individuals, but also how to get, through advocacy, more vaccines in an equitable way, reaching specifically the low and middle income countries. So I'll answer two questions, and the first one is why Jerusalem? I think that to most of you the answer is very clear, but allow me to elaborate with few of the signs that you see below. In the middle we see the value of helping our neighbor, thy neighbor, of being guided by Tikkun Olam and guided by support to others and not just to ourselves. This is a value that comes from the writings of the religions in Jerusalem, but also from the very basic morals we live on. Jerusalem has been described as the center of the world, and as you can see on the left side of the slide, Jerusalem is so close, being the only country in the world on the crossroads between Asia, West Asia, Europe, and Africa. And this presents a dramatic opportunity, and not just a challenge, to work within the neighbors, being countries neighboring to us, in support. And one of the supports possible is being also a startup nation. So innovation, new ways of doing things, and learning from experience has also been part of what Israel is all about and what Jerusalem is all about. So that's one answer why Jerusalem. But the second slide shows also that Jerusalem, being part of Israel, has been part of the leading countries in the world in vaccinating. Now the third vaccine, over 4 million people we've been just notified by the Ministry of Health here have been receiving the booster shot, 3 vaccines protecting all of us from COVID-19, a killing disease that has taken the lives of over 5 million people around the world. And the second part of the slide demonstrates a significant way of doing things. So Jerusalem does not only bring the leadership on policy and availability of vaccines, but it also brings the ability to practice the establishment of high-volume vaccination centers like the ones that all of the healthcare services in this city and in the country has done, and we are very proud of that. But it's also our ability to package and transfer the know-how. And what you see in the lower side of the slide is actually the publications, for example, of Professor Rabbi Steinberg, who is sitting here, one of the very first books in Hebrew and in English on the COVID-19 disease, also dealing with vaccination, and the specific ASIA, one publication that you also have the opportunity to grab when you walk out at the registration desk here on vaccinations and Jewish halakha. But we have also thought that it is important to address young people. So hitchasnut, vaccination or immunization, a very, very new, of last week, program that is available to all schools in Israel, both Arabic-speaking schools, the Haredi community schools, the Mamlachti Dati, and the general population can now benefit from a program, an educational program to schools to allow them to address vaccination more profoundly. And the second question is why faith? And it has been already mentioned that faith leaders, including the most senior leaders of faith around the world, have been less tapped until very recently in terms of their ability to apply trust, values, relationship at the most closest level with communities of hundreds of millions around the world. And it is time to look at faith leadership and its participation in the fight against COVID-19. And as we shall hear in a few minutes from our other speakers, this is not new. Religions have been part of addressing past pandemics in a very effective way. But it is also the practicality of faith-based organizations. And if we look at this map that demonstrates the percentage of healthcare services provided by faith-based health providers only on the African continent, you'll see that this is a very impressive element in national healthcare. And if churches, if faith-based organizations, if mosques are not just places of worship, but also places of provision of healthcare, and if the leadership of those faiths is participatory in the healthcare in their country, then we have a good avenue to develop further collaboration. It's also because we have ourselves as an organization, as an initiative, been part already of wider initiatives, like you see on the left side of the World Health Organization that has created a whole faith and COVID-19 task force, because we have been in contact with the Vatican through the Academy of Life, headed by a very important cardinal, who has done a remarkable effect on the junction we are talking about by having only last month the very first global health meeting at the Vatican in Rome, talking about the importance of reaching out to medicine, to public health in these dimensions. And also our participation with professional organizations like the American Public Health Association caucus on faith and COVID-19, faith and public health, that have been part and parcel of our work. And this is time also to recognize the steering committee members, which you see in front of you. Again, individuals who volunteer their time to be part of a think tank. And next to the names that you see in front of you as formal representatives of their respective organizations, I would like to acknowledge Nesia Cohen from the Ministry of Health and Yana Katz from Meuchedet, who are contributing dramatically to the work and to the efforts of the steering committee. We have done quite a lot since we have started in April of this year, and we are moving forward to 2022 with two circles in front of you. These are events that will be happening very soon. One is a course that we shall be conducting in Jerusalem and that will invite from around the world members of faith-based healthcare providing organizations to study with us the Jerusalem experience, learn from it, see what we can learn from them, and adapt a joint program for action in support of increased COVID-19 vaccination. And also ahead of us is the work towards enriching further our collaboration with other partners in this initiative. I thank you very much for now and would like to move fast to invite our next immediate speaker, which is Professor Rabbi Abraham Steinberg. You would note that in order to keep time and to be generous at the same time to our great speakers who have volunteered their time, in your folders there is quite a substantial information on each one of them and a very good picture. So I wish you to look there when you are trying to explore who are and the biographies of the speakers in front of you. But it is really giving me a great pleasure, Professor Steinberg, to acknowledge the friendship that has been developed, though this distance of generation, and the ability to learn a lot from you in this journey that we are on. Professor Steinberg's official title is in your program as the head of the Helsinki Committee at Shaarei Tzedek Medical Center, and is also the author of the Encyclopedia of Jewish Medical Ethics, for which he had received the Israel Prize. We are so thankful for you, Professor Steinberg, to be part and leader in this initiative and to talk to us.
Thank you, Dr. Shenkar. Really, it was and is and will continue to be a pleasure to work with you and especially to be part of such an impressive commitment and plan, which we hope will materialize soon. I'm going to talk about the religious aspects of pandemics from a historical and theological point of view. Obviously, this is a large topic, and the 10 minutes will not do justice to it, but I'll try to do some overview of the topics. למה זה לא זז? Oh. Okay, so our pandemic is obviously not the first in human history. Pandemics, epidemics have been with the human race almost since the beginning of the world. The pandemics that were prior to vaccination behaved a little different than what we are experiencing now, but in principle, they are quite similar. So if you will look already in the Bible calls an epidemic or a pandemic by the Hebrew word magefa, which we continue to use to date. Even in modern Hebrew, we call it magefat corona, which is the same term used in several instances in the Bible. And you can see that there was a pandemic or an epidemic already, one of the plagues of Egypt. It was called Dever, and Dever is both a generic name and a general name. Dever means a specific type of a pandemic caused by a bubonic plague, which we call in modern medical terminology, but Dever is also an equivalent to a pandemic in general, not only the specific bubonic plague, but actually any type of pandemic can be called Dever. You can see the numbers of people who perished during different types of pandemics, and remember the general population in those days, which was much smaller than we have it nowadays, so that the percentage of people died during these pandemics in biblical times were quite significant. So we have here a whole host of reports from the Bible that tells us about various epidemics. And it's actually epidemics because the description is locally, geographically subscribed, and not like a pandemic that is worldwide actually spread out. So as I said, Dever, it might be either specific, a pestilence plague, or a general one. And we will move to the Middle Ages and modern era. There were various pandemics, in a way even worse than what we are experiencing nowadays. And I would just draw your attention in the Middle Ages to the Black Death, which actually was, again, a bubonic plague, which happened in the 14th century and caused 50 million deaths over 6 years that it was there. By the way, from a Jewish perspective, it had an added tragedy because the world around, the Christian world, accused the Jews as the ones who caused the bubonic plague at that time, because Jews were less affected than the general population. And the reason Jews were less affected was because they were much more careful about hygiene, and therefore the infection didn't spread so much, and it obviously wasn't their fault that this has happened. But there were pogroms and blood libels against Jews as the source for this plague. In the modern era, there were several serious outbreaks of plagues. One that was actually divided into 7 different periods the cholera epidemic that lasted around 150 years until not very far recently, with short intervals between them. In one of these episodes, one of the greatest rabbinic authorities, Rabbi Akiva Eger, was the Jewish leader of the time, and he wrote guidelines to the Jews how to behave during this time. And actually, you can copy-paste what he wrote then and bring it to our time, to the COVID-19 pandemic, and they were very similar. You have to heed to what the professionals tell you. You can't do on your own something that you don't understand, and if they tell you this is how you have to behave, then you should follow it. Secondly, you should not gather together, not be crowded, even in a synagogue. During the high holidays, during Rosh Hashanah and Yom Kippur, he divided the Jewish people of his town into several groups. Some came to the synagogue spread around, and the others had to pray at home because there were too many to gather together. So a lot of similarities to our days. The Spanish flu, which was 100 years ago, there was an article in the Lancet a year after the pandemic finished, the flu pandemic, the Spanish flu, and you can read the description of what happened then and just change the date and you'll read it as if it happened today. Almost nothing has changed except for the vaccines that we have today and weren't available then. So there were quite a few of such types of pandemics. Now, a few lessons that I think we as believers, as people of faith, should learn from what happened. We don't know why it happened. We can ask scientifically and we don't get a clear answer. We can ask from a faith point of view, why did God create this pandemic nowadays in such a way? We don't know the answer. We don't ask why. But since it happened, we should ask what lesson do we derive of it, because when we learn the lesson, hopefully we'll become better people and perhaps even avoid a next pandemic. So I think that the one thing that we should learn is humility and modesty. There were times that scientists said Spanish flu will never recur. We know now virology very well. We know how viruses behave. There will be never such a pandemic again. And here it came again, and a very tiny, unseen virus is causing so much death and morbidity. So I think that we should learn to be more modest and understand that we can't control the world. From a religious point of view, I think that it is a lesson that there is a ruler to the world who leads the world, and he is the one that decides what will happen and what will not happen. And apparently he decided this should be here for reasons, as I said, that we don't know. Moreover, from a personal, humanistic point of view, we need a deep introspection, both individually and communal introspection. I think one of the greatest lessons that we should learn is that only if we are working together, only if there is a brotherhood between all people, can we survive and fight such terrible situations. What we actually see is quite the opposite. We see a lot of hatred. I don't want to go into politics, but everyone reads newspapers and listens to the media. I don't think this is how we strive for to see leaders of the country. There are a lot of wars. There's a lot of hatred between countries, between religions. All these have to change if we want to learn a lesson. And finally, I think the important lesson is that we should oblige to what experts are telling us, because they know more than we know, they know much better than we know, and we should follow what they say in order to control such a pandemic. Otherwise, there will be a catastrophe that will not finish. And currently, since the invention of the vaccines, I think that is a duty from a moral point of view, from a religious point of view, to adhere to the facts and see that that is the only way to stop such a pandemic. Millions of people died before the vaccination. People are continue to die if they are not vaccinated, and most of those who are vaccinated appropriately survive the pandemic, and we see that it goes down, and hopefully we will get rid of it altogether. So the religious point of view, to adhere to what experts are telling us, is written in specific laws mentioned in the Bible, and I think everyone knows them. I don't want to go in details, but there is a very fundamental basis to do what is right to keep ourselves healthy. And finally, I want to mention what Maimonides, who was both a rabbi and a physician, has said about following experts, and especially not only curing but preventing diseases, which is even a more important task in the medical field. And he said, a pious fool who refuses to allow a physician to help him but relies totally on God's help is like a hungry man who refuses to eat bread and hopes that God will heal him from the illness of hunger. The sick person who is not following medical advice and dies of the disease is equated to someone who enters into a fire which surely will kill him, so he is responsible for his death. I think these are very telling sentences, and we should keep them in mind. Thank you.
Thank you very much, Rabbi Professor Steinberg. Actually, for the next speakers, we built 2 staircases, so you can climb up here and walk down the other side. It will save us a few seconds. A few weeks ago, I met at the very close to the Jaffa Gate a young man. He's an architect by his training, but he's also a very brightening, illuminating, and interesting religious participant. And that is Father Davide Meli, who is the Chancellor of the Latin Patriarchate in Jerusalem. We've asked him to complement what we've just heard from Professor Steinberg with a different perspective, another perspective, an added value by looking also at the history. Father Davide, the floor is yours.
Thank you, Rav Steinberg, for your words. Thank you, Professor Shankar, for inviting me. And please forgive the fact that I don't have slides. That will require an added effort of concentration. In his book, La Peste, Albert Camus stated that si un prêtre consulte un médecin, il y a contradiction. If a priest consults a doctor, there is apparently contradiction. Here, in this gathering, we are to witness that the medicine of the body and that of the soul go hand in hand. In these brief remarks on history and theology, my point of departure is the statement that sacred scripture contains a faith-based understanding of history. Biblical figures and forms convey a strong message, which is God acts in human history. Yet, human history contains many events that have brought horrible pain to mankind. What can theology say about history when history appears far from godly? Epidemics are painful historical events. What can theology help us learn from them? I will answer this question from a Christian perspective. By reading selected sources, I will indicate 3 different epidemics. I will then provide theological insight by citing a theological source contemporary to each epidemic. I will conclude with a reflection on one sentence from the Gospel of Luke. The first epidemic I will mention is known as Cyprian's plague. It struck the Roman Empire in the 3rd century and dealt a blow to a society that was already in crisis. Historians haven't been able to pinpoint the exact medical name of Cyprian's plague, but based on the symptoms, some have thought it to be measles, others smallpox, others a viral hemorrhagic fever. I will exit the diagnostic diatribe that I'm not qualified for, but I will provide a summary of the symptoms described in the 3rd century. The sick experienced the inability to retain food, high fever, redness of the eyes, infection, and putrefaction of the limbs. During the plague of Cyprian, archaeological evidence shows that there was a repurposing of tombs for mass burials. Corpses were covered in lime to provide an added layer of protection to those who were living. The plague spread from Ethiopia to Rome, decimating the population and making the hardships of the empire worse over the years. Many Romans thought the plague had struck the empire due to the ire of the gods. They thought that Christians were to blame because they had angered the gods by refusing to worship them. In such a context, Bishop Cyprian wrote to encourage Christians to face the epidemic. He wrote a tract called De Mortalitate, and there he cited the book of Sirach, saying, I quote, "The furnace tests vessels of clay, and temptation torments the just." Cyprian's point of view is that what distinguishes the faithful from those who do not know God is that the latter complain about adversity and murmur, while we do not stray from virtue and from the truth of faith due to tribulations. On the contrary, these forge us through pain. Cyprian states that many of us die in this pandemic, that is, they are freed from the world, but that this plague shows whether the healthy be at the service of the sick. In other words, there's a dimension of care that is manifest through these epidemics. The key concept of Cyprian's thought is that death, for him, has been defeated by Jesus, and that a disciple who trusts has already abandoned the idea of living only for material things. For this reason, Cyprian encouraged the poor to offer service and the rich to give funds to help the sick. All the sick were to receive care, even those who had been actively persecuting the church. This new attitude changed Roman society. Remember that in Roman society, there were private, public, and army doctors, but they would serve the people from the same class or those who were able to pay. The concept of public health care did not exist as it does today. So this was a big step that was faith-based. The plague of 1348, which is a scourge not only medically, but as Professor Steinberg has also mentioned, socially. There was this stigma and this persecution that was obviously very wrong, morally speaking, and a sad stain on history, was actually born out of a sort of biological warfare. There's a manuscript from 1346, 1348, that was found, and the author, Musi, states that the Tatar armies that were laying siege to a Genoese city of Kaffa in Crimea in 1346 were struck by the plague. And since they couldn't breach the city, they began catapulting the corpses of their own sick inside the city. And that is how the plague reached the port of Messina and then spread throughout Europe, causing so much damage. The paradox here is clear in Musi's words: Fleeing is not right, but staying is not convenient. This is the problem when epidemics strike. I'll conclude. There is a question that remains then: how should plagues be attributed? To whom? To chance, to celestial conjunctions, as retribution for sin. In 1892, the cholera plague struck these lands, the Holy Land, and the Latin Patriarch of Jerusalem, Ludovico Piavi, dedicated a letter to the subject. He stated that those who study nature examine the causes of illnesses and epidemics, but we are to look further. He referred to the cause secundae. I conclude by saying that these examples of epidemics in the 3rd, 14th, and 19th century show us that there were two tendencies. One was to see the other as a potential enemy, and the other, which is typical of a journey of faith, is to see the other as a neighbor and to help the other. I conclude with a sentence from the Gospel of Luke, who was a 1st century physician. He reports some words of Jesus. When you see these things, epidemics, wars, coming to pass, know that the kingdom of God is near. This is a personal consideration. Take it for what it's worth. I had always considered the word near in a temporal way. According to such an interpretation, epidemics would be a sign that the end of history is drawing near. However, today, I propose to interpret the word near as indicating a nearness in space, a physical proximity in the here and now. The kingdom of God, as Professor Steinberg has also alluded to, means that God is in charge. There is a tendency in humanity to be independent and a certain resistance to letting God be in charge. We like to do things ourselves, and sometimes we forget that we have limits. We build our kingdom, so to speak. That is, we dominate the physical variables that surround us. This may lead us to great achievements, but it may also lead us to be so concerned with ourselves that we become unable to see others. As individuals and as society, we risk falling into entropy. When epidemics strike, we lose the things that offer us security. On the one hand, this makes us suffer. On the other, it pushes us to ask for help and to give help. In such a context, the kingdom of God, I would propose, can be interpreted as the security that God gives us, or the security that love and mutual care give us. In conclusion, theology, based on this interpretation of history, allows us to say that in epidemics, when we cannot rely on ourselves alone, we do begin to look for others and to see one another. Thanks again for listening and for inviting me.
Thank you very much, Father Davide, for taking us through some of the theological perspectives and historical ones connected. Very illuminating. Thank you. We move now to a segment in our meeting today, which is scientific and medical. And we have the privilege of introducing to you two physicians who have actually very direct, intimate contact with not just the virus, but the patients as well. The one is a treating clinical professor, and the other has guided the country in a safe way through the first month and weeks of the pandemic. I would like to introduce first Dr. Ramzi Kurd, who is the director of COVID-19 unit and a senior attending physician at the Department of Geriatric Medicine at the Shaarei Tzedek Medical Center. Dr. Kurd is a Jerusalemite, and it's really a pleasure to listen to you. Thank you.
Good evening, everyone. Thank you. My name is Ramzi Kurd. I'm a medical doctor, and I'm a specialist in internal and geriatric medicine in the Hospital of Shaarei Tzedek here in Jerusalem. I'm 33 years old, and I will tell about myself a little bit. I'm a husband to Hanin, and I'm a father to Ayman and Yusuf. I learned in Egypt, and I started my stage, the internship in Shaare Zedek. I continued to be to do my residency in the geriatrics department and then the internal medicine department. And in the late 2019, I started working as a senior attending in the internal medicine B in our hospital. And I'm smiling now because when I remember that time when the chairman of the internal medicine department came to us and said, "Did you hear there's a virus somewhere in China?" And she said, "We still don't know a lot about it, but it's probably getting to Europe now, and it will probably get to us, maybe sooner than we think. Did you hear about it?" with a smile. So we said, yes. And then our lives changed. I thought, what could happen? It's another virus, but no. And then she asks, "Would you volunteer to be in the Corona department?" I said, "Volunteer? Yes, it's my duty. This is my work, and I will volunteer." And it started like this. We started to think, the hospital started to think, where can we do such a department? We don't know nothing. We know that it's dangerous, and maybe not. We know that it's infectious, but we don't know how much. We know that people die, and then we heard about Italy, about Spain, and then we had the feeling of the horror. So our hospital did everything it could to manage and hospitalize these patients. And as you see, the hospital evacuated the neurological department at the start, and we called it Keter, the crown, because COVID looks like a crown, but it's not a crown; it's a tomb. This is my first time in this suit, which is called PPE. This was in the winter, as you see, outside in a tent, waiting for the first patient. And the feelings were, we cannot describe the feelings because we felt in a sauna, but it's winter outside. We felt there were a lot of wind, but we cannot breathe. This is how it ended for me, for now. I was chosen one of the 40 promising young of under 40 by the Marker in Israel. Thank you. In between, it's a journey of 1.5 years and still going. There was good times, bad times, hard times, sad times. We will talk about this. We will start about the virus itself and the disease. I know that most of you already heard and know, but because I'm a doctor, so I have to say it. So it's a virus and it's a disease. The virus is called SARS-CoV-2. It's a virus that we know about like 20 years ago in the SARS-CoV-1. It's the same family with a lot of differences. It's an RNA virus from the family of beta coronavirus, and this virus causes the disease COVID-19, and 19 is the year that it was discovered. The virus is transmitted human to human by what is called the droplet infection. A droplet is the secretions of our respiratory system, breathing, coughing, eating, sneezing, and there were some in the beginning we thought that it is aerosol. Aerosol, it means that it's like a tuberculosis. It's particles that fly in the air and stays in the air, and it's easily transmitted and much dangerous. But it's not. It is in some situations, most probably inside the hospitals. Because if we are intubating a patient or we're doing mechanical ventilation or suctioning or whatever, that deals with the upper or lower airway, and then there is some of aerosolation. And this is important because we were inside the department where it's aerosol. In general, it's a multi-system disease. We know it's not only in pneumonia, an inflammation of the lung tissue. It is a multi-organ. It can attack the heart. It can attack the brain, the skin, and the most dangerous is a hypercoagulable state, which causes clots in our veins and arteries. In general, these are the four settings of the disease, the severity scale of the disease. It is mild if there's mild symptoms like fever, weakness, cough, and it's mild in our perspective, but it's not mild in the patient's perspective. This can be caused. This is the long COVID. The long COVID that patients stay with about 6 months after recovering from the disease, without fever, but it's mostly the coughing and the weakness. So it's fever, weakness, coughs, headaches, loss of taste, and many others, diarrhea and others. The moderate, that there is pneumonia, and pneumonia is an infection of the lung tissue. But with the O2 saturation is how much our blood is oxygenated with blood. Our blood is oxygenated, it's above 93%. Severe, and these are the most of the patients that were admitted to the hospitals. It's shortness of breath, it's O2 saturation below 93, and the need for oxygen therapy. The critical patient is any patient that is that has to be mechanically ventilated or non-mechanically ventilated. He has a multi-organ failure. You probably heard about ECMOs. And sepsis, which is inflammation syndrome that the body feels or diseased because of the virus, and some, of course, bacteria about an infection, and a shock, which is an unstable patient. Worldwide, I will give some statistics worldwide from worldmeter.com. This is until the 7th of November, there were 250,005,000 confirmed cases of corona. May their souls rest in peace. 5 million has died, and about 200 million were recovered. In Israel, about 1,003,000 recovered. May their souls rest in peace. Deaths were about 8,122. And until now, we counted about 1,333,000 total number of cases of corona. In Shaarei Tzedek, when I talk in Shaarei Tzedek, I will give only glimpse because the lack of the time, every one of them needs itself about an hour. So the glimpse are like this. We managed about 30,000 cases of corona in Shaarei Tzedek. About 5,000 of them were hospitalized. The others, of course, were in the ER, pregnancy, after delivery, patients that did the dialysis, and many more things. At the fourth wave, we had the C number of patients on ECMO in Israel. It was 9 patients altogether, and one of the patients was treated with ECMO. He got better, and then he relapsed. So the ICU had to put him on an ECMO twice. And recently, this patient has recovered. And I don't know if you saw the news. He was in a wedding that his family did in Shaarei Tzedek. Eras, you probably say, what is era? Era is history. Era is many years. But for us, yes, it's eras. Every one of these eras felt for us a lifetime. The era of uncertainty. This is how it started. What is the virus? What is the disease? How do I protect these entries? We're outside, tents outside. The staff, all of them are volunteers, nurses, doctors, everything. Everyone, every medical staff staff was a volunteer at the beginning. How much do you know? Much do we know? We had to read. We had to be updated. We had to talk. We had to talk to our colleagues in Italy, in Spain. We even reached China. We heard and we talked and we discussed all together. Which equipment did we have? The equipment, other than to protect ourselves, we have to meet the patients. So the logistics department worked very hard to do the job and to manage the department itself. It's telemedicine, it's treatment from behind screens, it's monitoring, it's a lot of logistics from all around the disease itself. And above all, we have to protect ourselves and our staff. And then it was our first shock. May his soul rest in peace, Mr. Aryeh Even. May his soul again rest in peace. He is an 88-year-old Holocaust survivor that came to our hospital in a severe situation, in severe medical stress, and then he died. This was the first death in Jerusalem and in the whole country. We took it very hard because it is the first time that we see a death from corona. But we knew that there will be more. It's our duty to stand up again and think and try to manage and treat and to give everything we could. So we feel sad. And then we went into a propaganda. We tried to encourage people to put their masks, to do social distancing, to stay at home. So we wrote for them, נשארנו בעבודה בשבילכם, תישארו בבית בשבילנו. We stayed at the hospital, or for you, please stay at home. This is a glimpse about the first wave. The first wave, as you remember, most of the patients in the first month came from outside the country. There was no facilities to contain them and isolate them, so the hospitals were one of the options. So we had milder patients and thank God it was like this. We learned the disease throughout these mild patients. This is physiotherapy that we did in general.
מעולה, ועכשיו אנחנו חוזרים לאמצע, יד אחת למעלה, יד שנייה למטה, ומחליפים ביניהם, קדימה, וחמש, יופי, 4, יופי, 3, 2, 1, ובואו.
This was a change. This is something that we did not live and we did not learn, to do a physiotherapy throughout screens. And then the first joy, the first recovery patient about 1 month. Now we know that we can recover in 10 days, yeah? But back then it was about 2 or 3 weeks and we had to do 2 PCR negative tests. And we know that the tests stay positive. Now we know it, but so she stayed inside the department about one month until she recovered with 2 PCR negative tests, between them 72 hours. But then the era of the stress. The era of the stress, it concludes the massive number of patients that came in the second wave. It was very hard to us. It was very stressful. And in a time, we felt that we cannot treat another patient. And it's the most saddest second in the lifetime of a doctor that we say that we cannot treat another patient. We cannot treat another. We cannot accept another admission. If we divide it from medically and logistically, we had to stay updated. There were the treatments started to come. Enough evidence, not enough evidence. Equipment, ICU beds, delivery rooms, dialysis patients, operation rooms. We did everything that this patient will get the standard of care that he could get if he didn't have Corona. I'm fastening a little bit. And then the era of hope. Then we heard about the vaccination. And then the vaccinations came. And then we got vaccinated. And there were many questions. Our duty in this was divided to two. One is to continue treating the patients, because if you remember, in January and December, there was a lot of patients, positive patients, with a lot of deaths because of Corona. On the second hand, we had to go propaganding to get the vaccinations. But in the era of hope, we felt okay to treat patients. We felt that we had enough experience to treat these patients. Are we getting back to routine? But we live the routine now. How can we live with a pandemic? Questions that we don't have yet answers. We started to share the world, and we earned the trust because the fake news were killing patients. What did we learn? That mankind is complex. He can be sick, but he can refuse medicine. That we need leaders in times of stress and uncertainty. I therefore thank every and each of the medical and paramedical staff members for their great sacrifices. And it's only a taste. Stay healthy and thank you. These are my staff.
Thank you very much, Dr. Kud. You're an example that it's never too young to save lives. I would like to invite Professor Sigal Sadetsky to be our next speaker. Again, you can read about the bios of each one of our speakers in your folder. Professor Sadetsky has actually been surprised, just like Dr. Kud and many others, with this kind of a virus somewhere in China, but was able to actually get her professionalism and public health expertise and education in saving a nation. And we'll be very thrilled and delighted to hear, Professor Sadetsky, of how did you do that? And obviously, the challenges that have been part of the past are still partially in the future. Thank you very much.
Thank you very much, Dr. Inoon, for inviting me, and thank you for this wonderful event. I'm a true believer of the main and central role of leaders in this pandemic. And unfortunately, I will not be able to share with you what I've been through in the last 9 months of the epidemic because I don't have enough time to focus on that. But I will talk about the pandemic from epidemiology and public health perspective, and I would mainly like to focus on subpopulations, different cultures, because this concerns really today's meeting. How do I do that? Okay. And I would like to start with WHO. I came to be the director of public health services in Israel from a year in WHE, in World Health Emergencies in Copenhagen. And I want to tell you that in the work plan of WHO for 2019-2024, actually they had 3 main goals. It is called the 1 Billion People More program. And what they wanted to achieve in the next 5 years is 1 billion people more who will enjoy better health and well-being, 1 billion more people who will benefit from universal health coverage. It has to do directly with what we are talking today, vaccination, and 1 billion more people who will be better protected from health emergencies. And then a year hasn't passed and we tackled the coronavirus. And just a second. And if we look at the circle of, if we look at the circle of coping with emergencies, the first thing that we talk about is prevention, 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 prevention. And the last one is build back better, which means that after the crisis, we would like to grow, we would like to learn and be stronger. And I just want to mention, as has been said here before, that the corona is not the first emergency and health emergencies that we have tackled. I just gave you a few examples: the Chernobyl nuclear accident, the Syrian refugees in Turkey, the floods in Serbia, the measles epidemic, which I had the honor to try and take care of here in Israel, as well as in Europe and other places of the world. But the corona is a huge thing. It's a pandemic. It's more than we've been used to, if we can say such a thing about a disaster and an emergency. And here we can see the world map. The numbers have been mentioned, so I will not repeat them. We have passed 5 million deaths around the world, and that's an underestimation, actually. And you can see the map of the world. I still remember the first map that we saw with coronavirus during January, and all we've seen there was one point in China, and the way that suddenly it spreaded from one place to another. And here we can see the 4 waves in Israel. The first wave now looks like a bump, no more than a bump. In the worst day, we had 700 positive cases. I'm very proud to say that in the first few months, until June, we had less than 300 deceased people. And this is where we were very afraid of the epidemic. It was not called a pandemic then, because this is where when the disaster in Italy occurred, this is where, as said before, we knew very little about this disease and how to handle it. Then we had the second wave, the third wave, and the fourth wave. Now, I'm now talking about what we've gathered here to talk about, different populations, and I will show you some evidence and some data about the differences between the Jewish general population, the ultra-Orthodox population, and the Arabic population in Israel. And you can see that there are differences. What you see here is the rate of the disease per 10,000 population, meaning that the size of the population was neutralized here. And you can see that among the ultra-Orthodox population, the rates were very high. You can see that among the Arabic population, you can see that the peaks differs from the general population. And actually what it says, and I don't have time to talk about it specifically, but what it says, that each wave, the reasons were different, and it all goes back to the behavior of the population. It all goes back to the behavior of the population. For instance, what you see here in the blue is the Arabic population, the black is the ultra-Orthodox. What you see here in the blue, in the second wave, the Arabic population had higher rates of the disease in the beginning of the wave, and this was because of the weddings in the Arabic community. So every time we try to connect the numbers with the behavior of the population. So actually, we have here a pandemic, a global situation, a significant disease accompanied by mortality, side effects, and uncertainties, still uncertainties regarding the future. It's a chronic situation by now, characterized by substantial collateral damage. Now we are trying to move from a pandemic to an endemic situation, meaning that we will probably live, I'm certain about it, we will live with this disease for years, I assume, but as an endemic situation and not as a pandemic situation. And it has a lot of collateral damage, economic crisis, challenges for the education system that we know about it, what happened to the children and young pupils who didn't learn. Challenge mental harms, loneliness, and depression. I want to let you know that whenever we have a health problem, the major collateral damage is depression and mental consequences. Decreased personal and social resilience, and increased inequality between different sectors of the society, and sectoral split. And these are the things that I'm very, very sad about. I think it could be avoided, could have been avoided, and I think that leadership like the one that religious and faith leaders have can really help treat these consequences. So let's talk a bit about vaccinations. And what you see here is the vaccination rate in the population. You can see here the general population, you can see here the Arabs, and you can see here the ultra-Orthodox Jews. And you see that there are differences in the compliance to vaccination between the different populations. If we're talking about what is called high immunity, people who have the full protocol of immunizations or have been infected in the last 6 months, you can see here that among the general populations, we find the higher rate of high immunity, 67%, among the Arabs, 41%, and among the ultra-Orthodox Jews, 46%. And we can even go deeper and see, I mean, part of the differences are because of the portion of children beneath 12-year-old in the ultra-Orthodox population, for instance. But also you can see, look at the purple area. The purple area is people who complied with the full recommended vaccination program. You can see that it is lower in the Arabs population and even more so in the ultra-Orthodox population compared to the general population. And what's really interesting to look at is these blue and white stripes. These are actually people who only got 2 vaccinations, but did not come for their third vaccination. And you can see that this portion is largest among the Arabic population. So something happened in the compliance of the Arabic population between the second and the third dose. This is something that can be treated with the right guidance and with the right confidence of the population in their leaders. Let's look at other data. We can see here the percentage of confirmed cases by sector. And you can see this here, that among the Arabic population, the portion that has been sick is equal to the portion of this population in the general Israeli population. But if you look at the ultra-Orthodox population, you can see that they constitute only 11% of the population from the total country population, but 26% of them have been confirmed, meaning that they had higher rates of infections. If we look at severe cases, again, we see some very interesting data that give us hints where we need what are the things that we need to take care of. You can see here that among the Arabic population, which, as I said before, they weren't sick more, they weren't infected more than their portion in the population. However, when we look at severe cases, they have higher portion. And actually, the reason for that is because, and it's not because they are old, on the contrary, this population is relatively young. They don't have many old people in the Arabic population, but this is because their health status, their health situation is lower to start with. So this is something that we need to treat. This is a place where we can intervene, public health speaking, and leadership perspective speaking. If we look at tests, I'm looking at tests because this is compliance to something that was recommended differently in different periods of the pandemic, but still, again, we see differences in the compliance of the population to taking tests for COVID, and again, we see lower compliance among the Arabic population than to, let's say, the general population, which were tested much more than their portion in the population. And last data that I'm going to show you is the vaccination rate by region in Israel among the Arabic population. And you can see here major differences between the blue line, which is, or let's take the purple line, which is Jerusalem and central Israel, and between the south. This is the south is the red line. You can see here that in the south, the Arabic population show the lowest rates of vaccination. So we know where we need to, what we need to approach. We know where we need to intervene. So we live in the same country. The recommendations are the same recommendations, but the compliance is different. So under the umbrella, one person is staying relatively wet and the other one relatively dry, and the other one is completely wet. Now I want to tell you a story that I handled myself. So there was a man who was diagnosed, his wife was with a disease, his wife just gave birth and was hospitalized, and he visited the following places. While he was sick, 7 synagogues, a yeshiva, a wedding, a circumcision event, some of the hospital wards, because both his wife at the labor room and then at maternity ward, and then his baby was in a neonatal intensive care unit, and his father had an operation at the same time, so he visited him, and he visited a lot of public health areas. And now look at the date. What do you want to say about this date? The date is December 30. This is before the corona, right? Yes, because this is the measles. This story is from the measles. This story is from the measles period, but it is a true story, okay? And of course, it's a story of an ultra-Orthodox person from Bnei Brak. And when we look at Bnei Brak, I mean, it's no wonder that the rates are so high among the ultra-Orthodox Jewish population, because they are very crowded, because they have a lot of connections with other communities, also Sikh communities, high fertility rate, therefore high. With the measles, it was important because children were the ones who transmitted the disease. And there were vaccinations issues among this population, not as people think refusal to vaccinate, but only delaying vaccinations, which was enough in order to transmit, to spread the disease very, very easily. And if we look at the corona, we wanted people to be isolated at home. We had a lot of days that we had to stay at home. But listen, in a very small apartment with 12 children, it's not that easy to stay safe in an epidemic. So what are the toolbox that we have for coping with the COVID? I will talk about it very briefly due to time issues, but basically we have only 2 arms. We have cultural and social tools, which include personal behavior, like the masks that you all wear here, or the remaining in distance. We have restrictions of crowding, which are very, very effective, but they contradict human nature, because we want to gather, because we want to be together, because we want to meet each other. And we have the lockdown, which has a lot of damages, and everybody knows about it. The other arm is the technological arm, and this is really what differs us, this era, the pandemics and epidemics of this era, from the previous ones. So we have tests, and we have medications, and now we have some new medications that are under examination for approval at the FDA that will treat early stages of corona and will prevent deterioration. But our main goal is the vaccination. This is our way out of the situation. I don't believe that we will be able to eradicate the corona pandemic anymore, or endemic situation, but they are effective. They give us herd immunity and so on and so forth. We all know that, but they also have some downsides, especially the uncertainties regarding to waning of immunity, the need for booster, the genetic variations that I hope not, but probably still waiting for us, and so on and so forth. So we have unexpected challenges. I believe that we need all of the box tool, but we need it differently in different times. And of course, the vaccination is the first strategy that we want to go for. I would like to end by talking about, very briefly, I would like to say that in Passover and Independence Day of 2020, there was a very good collaboration between all sectors in Israel. And it's very important for me to remind this to all of us, because I do believe that with the right leadership, this can be achieved, as much as I believe that increasing vaccination rates can be achieved. This was before the vaccination, but these pictures are from the Corona hotels. They celebrated Passover in a safe way. We had a lot of support from the leaders with regard to safe Hagalat Kelim and Bi'ur Chametz. I'm sorry, I don't know how to say these in English, but people, but there were great collaboration. You can see here, this is a question that was asked in a survey. Are you going to intend to accept and fulfill the instructions of limited celebration of Leil Seder? And 93% of the population said yes. And these were the instructions in Bnei Brak and in Mea Shearim to have very limited celebrations. And also the Jewish population in Israel accepted the instructions not to go to the cemeteries in Yom HaZikaron, in Memorial Day. So everybody collaborated, and I believe that this could proceed and even be increased. So good compliance of the total population can be achieved by trust and confidence between the various sectors in the country. This is what I believe in. This is a picture of Dr. Tedros, the director of WHO, and he commented about the vaccinations. Right now, you know that he is a great supporter of vaccinations for everybody, about our responsibility to the total world. And he said, this is a time for facts, not fear. This is a time for rationality, not rumors. This is the time for solidarity, not stigma. So thank you very much for listening to me.
Thank you so much, Professor Sadetsky. I think this is a great segue to the panel that we shall be inviting its participants and its honored moderator in just a minute. But I would like to pause for a second and ask Gadi Ilan from the Shaarei Tzedek management to greet us on behalf of Shaarei Tzedek, as Professor Marine had a last-minute responsibility at the hospital and could not join us. But Gadi is the member of the management of Shaarei Tzedek, and we are very pleased that you are here and willing to represent the hospital and greet us all on behalf of Shaarei Tzedek.
The briefly I had to arrange to this spoken is the briefly I had to build the departments of Corona. I want to start with a story. A month ago came a woman birth in Shaarei Tzedek, and she said, I'm here to getting birth. My father is in the Corona department four floors down. Unfortunately, her father died an hour ago. And we didn't know how and why and how to tell her a minute before her birth that her father is gone away. The social person was running between the floors and asking people what to say, to tell her, not to tell her. I won't give you the answer. Everybody can think what you have to do in this moment. But this is what the pandemic takes us to places we didn't know how to do. Everybody, I'm a logistic manager. I did things that I didn't know. I built the departments in tents, not in hours, but in days, things that they take years to build, I took it in hours. And it was incentive care units and everything. Everything was built, things that we didn't know how to do before, but we learned during going how to treat this COVID. I think that the vaccination is one of the things that God gives the words how to solve problems that the word itself doesn't know how to solve. People are the bringing into imperation to do the implementation of this, but God's always give us the solution. We, the people, must find the solution. This is our goal in the word. Rabbi Zak says that if we will know why the evil is in the world, we will become robots, because we will know, we understand this is an evil, and God's, he has the reasons of the evil, and this is why he gives the evil. So we won't have to do nothing. But we have to do. We have to work, and this is why Shaare Zedek was very pleasure to invite or to participate this issue for Muslim and Christian and for sure Jews, how to solve all over the world the vaccination, let's say, wave, and do it all over the world. Like we can see now in Germany, there is a big problem. We thought that Germany is a thought of people that is thinking hard and things like that, not to mention Africa and all over the world. So Shaare Zedek is blessing this confidence, and we are very hope that Torah will go from Zion and we will vaccinate all over the world. This is the solution of God, and this is the solution for us, the people, to bring this solution to everybody all over the world. I hope my words will come all became strong. Thank you very much.
Thank you very much, Gadi, and thanks a lot to the Shaare Zedek Medical Center here in Jerusalem for being a co-sponsor. Gadi himself is a member of the steering committee of the initiative, and we really appreciate also the center's contribution to the success and to the finance of this event. It gives me a great pleasure to invite one of Israel's most known journalists and health editors for so many years at the Jerusalem Post, Judy Siegel-Itzkovich. She's now the health and science editor of Israel 365 website, and she has been so enthusiastic, if I may say, to moderate the panel that actually, as I said before, Professor Sadetsky, by illustrating to us the hard facts of epidemiology and the distribution, the unequal distribution of COVID-19 among different sectors within the Israeli/Jerusalem society, to actually broaden our understanding through listening to a panel that represents not only wisdom and the diversity of Jerusalem and Israel, but also that could take us through another informative session on COVID-19 and the faith public health junction. So I would like to invite one by one, and again their bios are in front of you, Judy Siegel-Itzkovich, Rabbanit Devorah Everon, Archbishop of Constantina, Archistarchos, who is the Greek Orthodox Patriarchate of Jerusalem, Qadi Muhammad Abu Obeid, and Dr. David Rothstein. They will all be joining us here on stage to expand our wisdom and understanding on the difficulties of reaching to faith communities. Thank you very much for agreeing to participate with us.
everyone. Do you hear me? Yes, okay. Our panel members, we have 35 minutes for this panel. Our panel members consist of a Greek Orthodox Archbishop.
Just a second. Turn on the
We have 35 minutes for the panel. Our panel consists of a Greek Orthodox Archbishop who first came to Israel 46 years ago and speaks 6 languages, a senior Muslim attorney and judge who is an expert in ethics, a highly respected woman who teaches Talmud and is the first spiritual leader of Bar Ilan University in Ramat Gan, and a leader of the World Baha'i community, a prominent physician who is also a public health expert. They dress differently and they look different and they observe different rituals and holidays. But they all believe in God, I am sure. And their lives are guided by ethics and moral teachings of their religion. They were chosen by the organizers to provide various viewpoints on the coronavirus vaccination available to all Israelis from the age of 12. And as we heard last night, very soon there'll be a vaccine available for children from the age of 5. I'd like to hear from each of you whether your religions encouraged or discouraged vaccinations when the Pfizer shot initially became available, and if anything has changed since then.
I start with? Oh, me. Okay, thank you. Thank you for having me in this gathering. And first of all, assalamu alaikum, peace be upon you. Actually, in Islam, the Prophet Muhammad, peace be upon him, once was sitting and a Bedouin, a man from Arabia, from the desert, came and asked the Prophet, shall we take medication? Is it possible? Because we believe in God's faith that man will be ill and will be sick, and sometimes God will cure him. Why shall we take the medicine? And the Prophet said, there is a lot of illness and sickness, and for each one, God has created a cure. Some of you will know the cure and others will not know. So take the medication and take it for yourself. So from the religious point of view, you shall, and you in certain situation, even you must take the vaccine or the medication, because it is the same thing that you have the fate of being sick, and also you will have the fate of being cured. And the second Khalifa Omar, once he was coming to Jerusalem, and in his way, he knew that a disease was around Jerusalem, and he turned back. So some people asked him, Omar, why you are fleeing away from your fate? If you're going to die in Jerusalem, so go and die there. Why you are going back to Mecca? And Omar said, okay, I'm turning back from one fate to another fate. There is a fate that you are going to be sick, and there is also a fate that you are going to cure yourself. So the point here that, also I'll give another example. The Prophet once was in the mosque, and an Arabian came with a camel to the mosque, and he didn't tie the mosque outside the camel outside the mosque. And when he get out of the mosque, he said, oh, where is my camel? And he said, what happened? My camel is not there. And the Prophet asked him, did you tie your camel before you went to the mosque? He said, no, because I relied on God. He said, no, tie it first, and after that, rely on God. So these 3 examples give us that you should not rely only with your prayer, but you should take the cure, you should take the vaccine, and so it is an obligation for Muslim to take the vaccine. But concerning why people are not taking the vaccine now, we'll talk about later on, inshallah. Thank you.
Okay. Your Eminence?
Yes. I am honored to participate in this event in Van Leer today, and I am thankful as I am honored to participate in this panel with distinguished participants. And concerning the attitude of the Christian faith in general and of my church, the attitude to the pandemic, I would like to share with you that we, as I could say all humanity, we were awakened of a sudden and we found ourselves in a new situation a year and a half or more ago, and that this pandemic has changed many aspects of our lives, many structures of our lives, has brought us to many difficult situations. It has influenced church events, religious events, education, economy, families. It has caused millions of deaths. We know and we follow up by media, TV media, the consequences. So the attitude of my church, the Church of Jerusalem, Patriarchate of Jerusalem, and of the local churches of Jerusalem, and to an extent I can speak about churches, Christian churches all over the world, is positive to vaccination. Vaccinations also in the past and today were the means by which we face diseases, and especially this great disease, which is a strong virus. And we believe that God permits to doctors in all eras of humanity. God permitted that there are doctors, there are physicians who, through their research, find weapons to attack the disease. Now, in my church, in cooperation with other churches in Jerusalem, was for vaccination, and it encourages our faithfuls to take vaccinations. And our Patriarch Theophilus, who participates today in the event in the President's house, was among first to take vaccinations, and I took vaccination, the third one. I believe that from this pandemia, God first protects us, but also vaccination protects us. Now, and in the local church of Jerusalem and in our brotherhood, which we are, because we are a brotherhood, most of us took vaccination. But there are still some who are a minority, they are not yet convinced to take vaccination. We try to convince them, and they connect vaccination with different things. They believe that there are materials which hurt the health and which have consequences in the future, and they give to it, attribute to it religious aspects. They relate it to the end, to the end of the days, and the church was against this attitude and tried to change it. There were from our brotherhood, were affected, and they were hospitalized, and some of them in Shaarei Tzedek, and we are thankful to Shaarei Tzedek, to Friends Hospital, and they were cured. No infected, but not of us was affected, was died. And there were people who were refusing, for the reasons I told, to take vaccinations, and they entered the last moments in the hospital, and thanks God, they were saved.
Very good.
Concluding, I say that the church is for the vaccination.
Very good. Rabbanit Devron, you're modern Orthodox. If you could also speak about the ultra-Orthodox community.
Thank you. Thank you very much for inviting me, and I'm very honored to be sitting here amongst the distinguished members of this panel. COVID came out in December 2019, and the vaccines came out in December 2020. And the discussion amongst the rabbis, the questions and answers that were sent in, started a little bit before December. Reb Asher Weiss was I think the first, or the main rabbi that came out and actually gave answers to two questions. The first question was, are we allowed to be vaccinated? And the second question was, must we be vaccinated? Mm-hmm. And the answers that he gave were that we are allowed to be vaccinated, and while he recommended to be vaccinated, he did not, in that answer, say that it is an obligation, that it is a religious obligation to be vaccinated. Mm-hmm. And when you look at the different answers, both the ultra-Orthodox and the modern Orthodox answers, you can see December 2020, January, February, March, you can see that most of the 99% of, or even 100% of the rabbis gave the answer that you are allowed to be vaccinated, and they even recommended. But it took some time until rabbis came out and said you must be vaccinated, and that you can see later on in the year or the year and a half as the pandemic progressed. Mm-hmm. And so today, I just looked before I came here. You can see more and more specific rabbis like Rabbi Kanievsky and more, and also organizations of rabbis like the rabbis of Binyamin, of the regional area of Binyamin, etc., that encourage people to be vaccinated, and some will say that it is also a religious obligation to be vaccinated. Mm-hmm. Now, do the people adhere to that or not? I think that that's something that we can go into in a few moments.
Dr. Rutstein, you're not only you're a leader of the Baha'i community, but you're also Deputy Surgeon General of the United States, #2 physician in America, which is very impressive. What's your view about it in the Baha'i community?
Well, first of all, thank you to Dr. Shankar for inviting me to be here. And I, too, am honored to be with such a distinguished panel. Baha'is believe that science and religion are part of the same continuum, that they have to be in harmony, that science, without the ethics of religion, can lead to great destructive forces, technologies that result in weapons of mass destruction, etc. And religion, without the logic of science, can lead to superstition and conflict. So in that light, when any medical or public health event occurs, we consult the best science. We not only consult the best science, but we adhere to the recommendations of the scientific experts. This principle is so strong that even physicians who are sick must consult the best science, not themselves, must consult someone else and take that advice. So yes, Baha'i communities around the world have all consulted physicians, whether their own personal physicians or public health experts, and if they have access to the vaccines, and you know there is some equity issues in various countries, they all get vaccinated.
Very good. Some conservative groups are, is it working? Some conservative groups are suspicious of scientists, unfortunately. Is it possible for religious leaders to persuade them to about the benefits of vaccination?
Yes, I think it is possible, and it is their obligation. And we have done it. There were messages from heads of churches here in our patriarchate in cooperation with other local churches, Latin Patriarchate, the Custode of the Holy Land, and the Lutheran Church, and so on. And there were common messages encouraging the faithfuls to take medicine and to refute the conception that vaccination is bad. And also, by our attitude, we witnessed it. I mean, we were for it. We cooperated with the health authorities, health services of State of Israel, and also with the police. And we fulfilled the instructions of the health services and the police, and we limited very much the number of the faithfuls of the congregation in the churches, because this virus is contagious if many people are overpopulated. And in the main churches of Christianity in the Holy Land, the Church of the Holy Sepulchre, and in the territories, the Nativity Church, there were times in which all this period, there were not many people. In some days, and for example, in Easter days of, not this last Easter, the Easter before, there were 10, the Patriarch and 10 priests in the Church of the Holy Sepulchre and the Holy Saturday, which is the day of the light. Only. Why? In order to prevent the virus to be spread. I mean, not only by messages, but all in the action, in the praxis. I think that the churches witnessed it.
Okay. Who else would like to comment?
Yes, the same. We, the Muslim community here, we had Mufti, and he has a medical committee surrounding him. And he was taking into account all the recommendation of the Ministry of Health. And I was reading his statement every day. He has taken the recommendation of the Ministry of Health word by word. And that's one thing. The other is, we know that Hajj, pilgrimage to Mecca, is one of the pillars of Islam. And it is very important. So we, for the last 2 years, we did not perform Hajj because of this disease. And it is very important issue, because a Muslim who did not perform Hajj, and Hajj is clarification of all of his sin. So millions were going every year to Mecca, but for the last 2 years, we have only a few thousands going there. So it's a message, it's a call for all Muslims that even one of the 5 pillars of Islam can be denied or can be overcome in order not to endanger the other Muslims and the other society and the other people. So we find that the recommendation of the scientists were very important. Another thing, mosques were closed, and Jum'ah prayer was not performed in the mosque and not even outside the mosque. And it is very important prayer for months. And the Ramadan of the year 2020, we did not pray the Taraweeh prayer, and we were listening, and we are taking it into account that we have to oblige to the recommendation of the Ministry of Health. And the Grand Mufti here has also taken it into account, and he said that the recommendation of the Ministry of Health is binding on us. So it is very, very clear statement that the recommendation of the Ministry of Health is binding on all of us. So
you think next year you will?
I do think, yes, because, you know, you have to know that also many people thought that the coronavirus, the COVID-19, is a conspiracy. And the social media was full of these things. And as a matter of fact, we Muslims and Arab here in Israel, we are not only watching the social media of the people who lives in Israel. We are connected to the social media of millions and hundreds of millions of Arabs all over the world. So we are influenced also by the conspiracy theory which people carry all over. But fortunately, and despite the numbers that we have heard few minutes ago, fortunately that our situation is good concerning to others who are in the Arab world. So we are listening, we are bound by the recommendation of the Ministry of Health, and again, even next year and the year after, we will continue to do that. Thank you.
I think you've talked about how the higher leadership can persuade people or bring more people to be vaccinated. But I think that one of the important issues are the community religious leaders. The people that know personally people that are having difficulty coming to be vaccinated. And I think that there a lot of the work has to be done, should be done on the communal level. Sometimes even helping them logistically, getting there. If a woman has 12 children and her husband isn't at home because he's working or he's learning, and she doesn't have what to do with the children so that she can go be vaccinated, so she'll postpone it and say, okay, I'll go tomorrow, the day after tomorrow. Here, community religious leaders that know what goes on in their community are very, very important, both in talking to them and persuading them, being empathetic, knowing what is concerning them, talking to them about them, and helping them logistically bring this about and becoming vaccinated.
Everything that has been said. I also would like to point out that there's very good data to show that the chief decider of a family's medical course is a woman. And when you focus on educating women and training them and also bringing them to the fore in decision making, you have a better outcome for any medical decision, including whether or not to get vaccinated.
Mm-hmm. Do you see any ethical problem with the fact that Israel bought vaccines for everyone and soon will be from age 5, but there are many poor countries around the world that don't have any vaccines or have very few vaccines?
I understand your question, and we have to sympathize with people of other countries who have not the possibilities which Israel has. But at the same time, maybe I'm allowed to say that to love our near man as ourselves. So לאהוב את רעינו כמו עצמנו. As I can believe that such a priority could be. And if there is a possibility that Israel or a rich state helps poor states, okay, it is an obligation, but every state, and also the state of Israel, has the right to give a priority to its citizens.
You know, maybe it's a disadvantage that we were the first to be vaccinated. And we became, like, you know, not every country was really ready and convinced that its population have to be vaccinated.
We were a laboratory.
Yeah, we were. And now, yes, we've made the right step and that we have vaccinated and to be first. But we did not take it as a matter of advantage. We did not thought that we will take the first vaccination in order to deny others of having it. We take it despite the risk of it. Right. So it's unethical because we put ourselves at risk and others get the advantage of us. So they have to look to this point also as a positive point. And we are thankful that at least we are the Holy Land. Sometimes we have some advantages here. Thank you.
Yes, Laura?
I think that we now know that while we were guinea pigs in the first vaccinations, we now know that they're safe and they're good. And I think that the State of Israel should be very active in an international task force in order to help other countries or poorer countries. I think that this is something that all our religions see as a very, very important part of our religion, looking out for others. And I'd expect that that Israel should be active in such an initiative.
Okay, David?
One of the great gifts. One of the great gifts of Corona is a graphic demonstration of how interconnected the world is. Mm-hmm. And as we saw with the excellent presentations here, the multiple waves, despite the success within Israel, Israel was affected over and over. And it really is a moral and an ethical issue, fundamentally, to be able to see the world as one country, and we're all citizens of that country. While, yes, we can all love the country that we're in, the citizenship of the country where we were born and what kind of passport we hold, but fundamentally, this is one globe, and this pandemic really demonstrates that, and we're all obligated to try and help the whole world.
Okay, and just to end the panel, if you could say...
May I?
Okay, yes.
I would like to say that I am thankful to God and thankful to the State of Israel for the good health services, which gave me the possibility to have this vaccination. Mm-hmm. And I would like to say also that I don't believe, the church doesn't believe that what happens to humanity, it is a punishment of God to humanity. God permits it, only permits it. But I think that it is due to our actions. We don't know yet where from, but from our actions, from our way of life, and from laboratories and so on, there are these effects. And this situation has to awaken us and to make us thoughtful and see which are the ways by which we can ameliorate the circumstances of our lives. Thank you very much.
If we could end by saying, everybody saying yes or no, would you recommend to every parent that he vaccinate his child from the age of 5?
Yes.
Yeah, no, it's okay. I beg your pardon, I understand you. What is your question?
Do you recommend that every parent with children from the age of 5 that they vaccinate their child?
If the specialist doctors, if health services suggest it, they have to take it in consideration and respond.
Yes, absolutely. And if I had children of 5 years old, I will be the first one to do that. But I was among the first people to be vaccinated on December 2020. Yes, despite the fact that I was infected of corona on September 20. Oh, wow. So after 3 months of being coronavirus positive, I also take the 2 vaccines.
My oldest grandson is 5 years old, and yes, my daughter will take him to be vaccinated.
Kol hakavod. Thank you very much.
Thank you.
Thank you so much, Judy Siegel, Itzkovich, for moderating, and our distinguished panel guests here, Rabbanit Dvorah Evron, the Archbishop of Constantina, Aristarchos, the Greek Orthodox Patriarch of Jerusalem, Qadi Muhammad Abu Obeid, who is the member of the High Sharia Court of Appeal in Jerusalem, and David Rothstein, the Secretary General of the Baha'i International Community. Thank you so much. I think this was very illuminating. And while we are a little bit beyond time, I would still like to remind you, those who are here in the audience, that after the next 2 short sessions, you will have the opportunity to bring out loud your own ideas. There will be a very nice lady waiting here with a microphone, which you can stand behind or next to her to pitch your idea in terms of on-the-spot solutions for COVID-19 from your own experience. But before that, we have the great honor of welcoming a chief rabbi. That's Chief Rabbi Michael Malkior, who is very well known to Israelis from his political work, but also primarily from his work in trying to bring together interfaith activities into a reality around many different areas. He's the president of Mosaika. He's also the president of Meitarim and the Citizens Accord Forum. And we are very thankful, Rabbi Malkior, for coming to talk to us and to the many hundreds waiting to listen to you around the world. Rabbi Malkior will speak to us on a very unique, unprecedented, there are many unprecedented informations that we had received here, but I won't take the surprise from him to illuminate and elaborate on the work of Mosaika with the World Health Organization in this area. Thank you so much.
Thank you very much, Dr. Shimkar, and distinguished audience. I would like to share with you, in the few minutes we have, some of the work we've been doing in the Mosaika Religious Peace Initiative since the outbreak of the COVID-19, and say to you that, first of all, what made it possible for us to work was that we worked together and built trust for many, many years, say for at least the last 20-odd years before that. So that because the trust has been built both inside our religions and between our religions over the years, and that we've been able to prove ourselves in many other situations, difficult situations, and we've been able to save thousands of lives. Because of that, there is already a trust which has been built on, and then you can then continue when a totally different kind of challenge, which we haven't experienced before, when that comes, you can then build on the trust which already exists from before. And this is what we tried to do really from the outbreak of the pandemic in, well, it was the first days of March last year. And we did it both inside our religions with decrees which we gave out and which were very efficient, not least in the Arab sector, in the Muslim sector, and also between, working together. So long time before the Ministry of Health gave out any kinds of decrees and orders, we had already given out our Piskei Halacha and fatwas. And especially the fatwas of our most influential colleagues went out from here and to the whole of the Muslim world and had an immense influence. I remember the first fatwa of my distinguished colleague, Sheikh Raed Bedir, which talked about closing down the mosques and having the muazzins calling not to call to come to prayer, but call to make prayers at home, which was quite sensational in the Muslim world. It was only adopted in the beginning by Kuwait. No other country in the Muslim world adopted it, and here in Israel. And then slowly, because people were surprised, how can you say such a thing? And it was not unheard of. And then slowly, in the next days and weeks, this fatwa was then accepted and adopted by more and more, and so on. And in this way, we were working with all segments inside the Jewish sector, and we started also to cooperate with different Christian leaders. And we were always working together with the best of the medical science. Always. Always listening to what is best to do. But we had one advantage also from the ministry, because we could act immediately, while the ministry always has to take all kinds of considerations. We don't have to take those considerations. And we have one other advantage, and that is we act according to what we believe is the divine law, which is more strict than what the Ministry of Health is. Because the divine law of saving lives is more strict. The Ministry of Health has to take all kinds of, naturally, make compromises and take considerations of financial, what happens with the finance in the country and so on. While we don't, when it comes to our study houses and our synagogues and our schools and so on, where we have influence, we don't have to take that consideration, obviously. And therefore, we can be on a stricter level, and still are on a stricter level. Let's say just now in my synagogue here in Jerusalem, when I in a few minutes will be unfortunately leaving to go and pray the afternoon prayer, we're praying outside, and we're praying outside with the masks, although when people come from outside, they say, well, the Ministry of Health say that outside we don't need masks. We need masks because we have a stricter ruling. We have doctors, again, we have a medical committee which we're taking advice from, but we have a stricter ruling than what necessarily the Ministry of the Health takes. Now, I want to just address what I was asked to from Dr. Shimkal. While we were working, we came across some of this, which was mentioned also by the former panel, some great issue of conspiracy, what is called also conspidemic, and which is today a popular name around. And a big issue which was costing a lot of lives. This was the first really big issue we had, and we actually contacted some of the leaders of the WHO to get their expertise in, because in this case we couldn't only use our local expertise, we needed to be the authority of the WHO. And when we got that, and we had a big conference call with the leaders of WHO, with all the religious leaders, and they saw how fast the religious leaders reacted to what was said in this conference call. So what happened immediately after this was that the whole mode changed. And after this happened, the WHO saw how everything changed, how the influence of the religious leaders, who were the authentic religious leaders, not necessarily those who have all the biggest titles, but the authentic religious leaders, how they could make the communities change their practices practically overnight. And therefore, the WHO asked us in the Mosaic Religious Peace Initiative if we were willing to go into a broader partnership. Now, it's not so easy because the WHO, as you know, is a governmental organization, and they've never, ever done before with an NGO a formal contractual partnership with anybody before. So it took 7-8 months until such a formal, then they checked everything we've done over the last, I didn't know that we had done those things which they know that we have done over the last many years, to see if their legal department could make such an agreement with us. And after having done that, we actually went into a formal partnership, which was a formal partnership which helped us because it could combine the medical scientific know-how, the work with the Ministry of Health, the work with the total religious leadership, and then establish what we call the Kavod Karama Dignity Project, and this again based on doing the project together, which we hope again will influence a lot of people around the world, not only now during the COVID-19 crisis, but we hope also for the future and help to save lives. What is important for us, and what, again, it started off with this conspiracy theory, as I told you about, but we've been able to put out a lot of conspiracy, a lot of conspidemics since then, using also the medical scientific expertise here in this country and from the WHO. We also have a partnership with the University of Haifa's School of Public Health to research the leaders. To the whole time, you know, you have anecdotes. We can all tell anecdotes of what has been happening. But we're now doing serious research of what happened during the pandemic and what was the real influence of the religious leaders who we've been working with, so that it can be shown in research, not just telling. Everybody can tell a story, this happened, this happened, this happened, but that we can be backed up with serious research about what happened in the Arab sector, Muslim and Christian sector, and also what is going on in the Jewish sector. We're putting together a documentary film about some of our religious leaders, and crafting toolkits and manuals to help health authorities all over the world to learn from our experience and how to engage influential religious leaders where it's most difficult and needed. So this is part of what you also said, Ki Mitzion Tetzeh Torah, that we can bring a message here from the Holy Land out from our experience, from what happened, from the positive things which happened, also the more difficult things which happened, and it can be all based on research, on science, and on the leadership which the religious leaders proved from day one, before, as I said, before the health ministries. And so this is the main thing I want to say. I want to share one other point, which I just wanted to comment on your very good next to last question. Because I have a partly different attitude than what the distinguished leaders here said, and I do want to share with you. I think that we do have, I do think that we as religious leaders have an obligation which we haven't lived up to when it comes to the rest of the world. It's not enough. It's true that we need to take our vaccinations and to call to all to take our vaccinations, call to the whole world to take the vaccinations. But we have a responsibility far beyond that, and we haven't done that. When we know that in the African countries, I don't know the figure now, but the last figure I saw was 6% and so on. Maybe it's gone up somewhat. When we know that, we have to, as religious leaders, demand from our leadership here in this country something totally different than what we've been doing. And we haven't done that. Our leaders, our religious leaders, have not been standing on the doors of our political leadership saying, we have to pay, we have to pay, we have to give. It doesn't mean that we don't take the booster, okay? It doesn't mean that. But we have to demand that we are now this is our obligation in solidarity with the world. First of all, it's a religious, ethical obligation, but it also pays out, because if the last person in the world, if the world is not vaccinated, then we know that of the dangers of that. I don't have to expand it, everybody knows that. So it also, here it's beneficial for us also, and it's also ethically right. And this is, I think, part of the divine message to us here is how interdependent we are on each other. There are no borders. There are no borders for hatred. There are no borders for wars, for hatred, and there are no borders for environment crisis, and there are for sure no borders for pandemics. And this is, if there's a message also from God here which we can learn, and no difference between blood and blood, between a human being and human being, and our solidarity here is absolutely an important religious message to all of us. Thank you very much for listening.
Yishar Koach, Rabbi Melchior, for your very strong last message. And if you had noticed, Rabbi Melchior had flipped the coin for us. So if we have talked about difficulties, here comes a person who talks about solutions. And that is exactly where we are heading with our next set of short 3 interventions before we come to the closing statement and inspirational conversation by Rabbi David Rosen. I would like to invite Rabbi Oded Mazor, who is on the formal note part of the Maram, which is the Council of the Reform Rabbis in Israel, but also one who has done action in terms of the challenges against COVID-19. Thank you very much for agreeing to speak to us, Rabbi Mazor.
Good afternoon. Thank you so much for inviting me to participate. I would like just to start with adding another sentence to the last topic of caring about the rest of the world. And I think caring for the rest of the world as a joint endeavor of all religious leaders is very important. We must start with not standing aside and taking care as the State of Israel of our neighbors in the Palestinian Authority. And I'm very honored to also be part of Rabbis for Human Rights who have joined in calling the government of Israel to supply vaccinations to the Palestinian Authority. These are our neighbors in this land, and we must take care of them. But my main topic today is the act of prayer. The act of prayer contains within it several different components. The prayer of the established religion, and certainly the public one, is first and foremost worship. But because there is liturgy formulated and shaped by human beings, it also has a declarative and educational component. This is our faith, this is our way, this is our perception of our place as human beings and how we deal with a given reality. This is true not only for those who show creativity and innovation in prayer and its formulation. Not to change anything in prayer is, in face of shaky events in reality, is in itself a religious statement. In the Reform movement, since its inception a little over 200 years ago, the accuracy and updating of the wording of the prayer, conceptual editing, and verbal accuracy have been a central axis and a defining one. There are many examples of this over the years. The corona plague and its health and social consequences have created a need for responses of various kinds to the new reality. Questions of using technology, redefining the kehillah, the praying public, and creating a community have occupied all the world's religions for the past year and 8 months or so, certainly all Jewish streams. Again, even those who have chosen to answer immediately with the answer of nothing changes. In Reform Judaism, as part of the constant preoccupation with the content of prayer, the corona raised the need to examine the way in which we would also relate to it in our prayer. The Reform movement in Israel also published a new Israeli Reform prayer book, Sidur Tfilat Adam, during this period. So with practicing liturgical wording was placed before our eyes and our hearts. A first example of this is a special emphasis given to all the words in the prayer that deal with illness and cure in anticipation of recovery. Every Friday night on Kabbalat Shabbat, we sing a centuries-old piyut called Yedid Nefesh with the words Ana el na refana la, based on Moshe's prayer for his sister Miriam to recover. In the days of the corona, this sentence was given special intention, focused on the hope of all to be cured. Another example is the verse from Psalm 92, Od yenuvun beseivad shenim vera'ananim yiyu. They will bear fruit even when they are old, full of sap and freshness. This was emphasized in a different and very strong way in the many months in which we cared for the older generation in our communities and throughout the world. I want to share here a number of prayers in the order in which they appeared, an order that reflects the struggle of all of us with the corona, the social, medical, community process we went through. In our community, Kol HaNeshama in Jerusalem, the first need that has been answered by a new prayer is the need to express our deep concern and great appreciation to all the medical men and women who have stood at the forefront of the fight against the virus and saving lives. Rabbi Ayelet Cohen from New York, a conservative rabbi, composed a prayer that was translated into Hebrew by Rabbi Noah Satat, a Reform rabbi and member of our community here in Jerusalem. So this is a prayer that we added in the special prayers section after the Torah reading on Shabbat morning, blessing all the different people who are involved in taking care of our health and fighting for it. And as it says here, bless them in their coming home and bless them in their going out. Ease their fear, sustain them. Another need that arose with all the isolations and closures, and then also the hybrid reality we kind of got used to live in for a while, in which part of the community is in the synagogue and some of the members of the community are at home, was simply to acknowledge that we are together, yet in different spaces. Not to ignore, but to give expression and allowing those who are in the house to aim for their home to be a place of prayer. These verses from the book of Numbers and from Psalms are usually recited at the entrance to the synagogue. And the variations we created on these verses meant to sanctify the moment and create the prayer space in the house. So not just to saying, how goodly are thy tents, O Jacob, thou dwellings, O Israel, as we enter the synagogue, but also for those praying from at home with us on Zoom to say, how good is my tent and my dwelling? How good are our tents? When the vaccines came, there were also the dilemmas that I assume, and I even hope, that in spite of all that was said here before, we all experienced. Even those who completely trust the health authorities in Israel and around the world are likely to have experienced at least minutes of thinking and debating whether it is completely possible to trust, whether there is no risk to themselves and to their loved ones. There is a proverb in Arabic that says, Al-Subhani lima birlat, only God is not wrong. It is a sentence said to allow us, the human beings, to err and to acknowledge that it is entirely human. This means that even a well-considered decision may turn out to be wrong in retrospect. Most of us have decided, as many areas of our lives, to trust the wisdom, the experience, and the good intentions of the professionals and go get vaccinated. Still, apprehension has accompanied many people. And formulating a prayer for this moment has the function of giving apprehension a place, expression, and release, recognizing it as legitimate and trying through the possibility of praying in this moment of receiving the vaccination to strengthen the minds of the people being vaccinated. So as you can see, using verses and blessings and asking, may this act be for life and not for death, for a hug and not for distancing, for hope and not for despair, for cure, comfort, and good days. For you are the ultimate healer. Blessed are you, O Lord our God, King of the universe, healer of all flesh and source of wonders. As the controversy over vaccines became more complex and painful, and the pressures on both sides grew, so did the need to articulate this complexity. We do not know how we will continue to live with the corona and for how many more years it is with us, but we will no doubt socially bear the social difficulties that arose between those who trust the medical system and those who doubt it, between those who trust science and those who see the whole occurrence as conspiracy with hidden motives. The last prayer is meant to express concern for the well-being of our society in the face of this social rift, to remind us that beyond the pandemic and its physical harm, there are also interpersonal, family, and community relationships that we must work together to maintain even in the event of disagreement. Tolerance and pluralism are positions that are much harder to adhere to when it comes to decisions with implications for human life. Precisely because of this, even in a community that has largely been vaccinated and completely adheres to the government health regulations, it is important to me to lead a value-based, religious, and social line of recognition of our freedom of choice as human beings and mutual respect between us. And I also tend to think that this openness and the recognition that a prayer could create might bring people out of the corners that they might be pushed into by the existing social pressure. So I would like to read it now. Okay, so I won't read it now, but you can read it as I say my last sentence. Our role as religious leadership is to maintain the physical, mental, and social health of our communities and wider society. And I believe and hope that prayer, both as a public worship and in addressing personal and community challenges and fears, can strengthen us in all these aspects. Toda rabba. Thank you very much.
Thank you very much. We have one international speaker that will speak to us now, recorded live from the US. That's Barbara Baylor, who is heading the caucus on public health and faith in the American Public Health Association. Let's hear her for 7 minutes, and we come closer to the last two speakers. Thank you so much for your perseverance and listening.
The Caucus on Public Health and the Faith Community began its work in 1996 under the growing recognition that health issues are not the exclusive domain of federal, state, or local government, workforce, or public-private organization. The caucus continues to espouse this historic work of the faith health movement, which began in the 1980s by Dr. Bill Fogarty, former executive director of CDC, who enlisted the assistance from former US President Jimmy Carter to establish the Interfaith Health Program at Emory University in Atlanta, Georgia, to foster partnerships between faith and public health in order to close the gaps in preventing disease and improving health. The caucus, in official relationship with the APHA, assists in promoting, modeling, and providing a platform during the annual meetings that encourage and enable scientists, researchers, faith leaders, public health practitioners, lay health advocates to discuss and present their research, data analysis, education, information, training and resource materials, ideas, new initiatives, advancing best practices, promote collaboration and advocacy opportunities. The caucus organizes various sessions annually for APHA, and this year our caucus was given special consideration to host 3 invited sessions, which included a joint session with the Global Maternal Child Health Network. The theme for APHA this year was Creating the Healthiest Nation, Strengthening Connectedness, a very timely theme for the Faith Caucus, as we value the importance of faith leaders bringing communities together to promote connectiveness, health, hope, and peace, and to provide support to those who may have been traumatized physically, mentally, emotionally, and/or spiritually. So these are the sessions, some of the sessions. I'm just going to leave that on the screen for a minute so that you can see. I'm not going to go into each one of these. We had a roundtable scientific session, and we had an oral scientific session. And we also had, let's see, here's the screen. We also had a poster session. And we had over 25 people participating in these sessions. The three invited sessions that we are most proud about this year, I'm going to kind of share some information with you on this. On this first one, the caucus was honored to amass such a distinguished group of national and international leaders to share their wisdom about faith partnerships. And as you can see, to move that, we had people representing NIH, CDC, the World Health Association, the World Council of Churches, a well-noted Seventh-day Adventist church, and also we had the executive director of faith-based and neighborhood partnerships from the White House in President Joe Biden's administration. And all of these agencies and organizations agreed that the strategy and approach for reducing COVID hesitancy and increasing vaccine uptake lies in promoting a common shared aim among faith leaders and faith communities despite differences. They agreed that creating partnerships to reduce some of the polarization that we're seeing in society is needed. Also, they acknowledge the fact that faith leaders are trusted leaders and can be utilized to adapt the guidance, policies, and information from agencies and provide feedback, accurate information, and supporting advocacy work. In addition, they said that recognizing the importance of bridging systems, getting to the grassroots, and bringing those to the table to have a voice from the conception of any program development to the reporting of the research in layman terms is also very important. And lastly, recognizing a funnel approach is needed so that in reaching these communities in need, so that we are making sure that resources, information, and services are filtering down to the grassroots. Our next invited session consisted of national faith leaders. And as you can see here, we had the American Jewish Committee represented, the American Muslim Health Professionals, the Balm and Gilead, the Christian organization, and the Catholic Health Association of the United States. And these discussants talked about developing a faith-inspired vision to address health and healthcare, health disparities and inequities through a faith lens and faith language. And they said that is needed. and also to recognize that the Bible, the Quran, the Torah, all have sacred words that may unify, helping such as helping others, saving one's life, saved humanity. You shall choose life. These were some of the examples that they mentioned as examples of unifying sacred words, which can be used in the development of a unified faith statement. And lastly, but not leastly, our last invited session was the joint one with the Maternal Child Health Network. And as you can see, again, distinguished leaders from all over the world, from the Youth Vaccine Policy Network, the Christian Connections for International Health, the Center for Pediatric Populations, the Good Samaritan Hospital, New York Hospital Medical Center. And these discussants talked about what would actually happen if adult hesitancy continues to remain low and parents decide not to get their children vaccinated for COVID-19 and begin to question childhood routine vaccinations, which to date are saving lives of millions of children. UNICEF, WHO, and Gavi Alliance are all working together to provide information that COVID-19 has actually led to a disruption in routine vaccinations in general. And because of these disruptions, they're now starting to see increases again in outbreaks of diphtheria and measles. To date, 23 million children have missed out on basic vaccines through routine immunizations. He closed his remarks by utilizing a biblical principle found in the sacred word of Matthew, the 25th chapter, the 31st through 46th verses, to express a faith-based concept for addressing public health and COVID-19. He paraphrased, "Lord, when did we see you at risk for COVID-19?" Thank you very much for the time to share with you remarks on the caucus. Thank you very much.
An American intervention in our conference that has illuminated, I think, another action, this time in the scientific world, of gathering together experts from different faiths and the international community, WHO and others, including the Biden administration currently, and local community leaders in action of exchanges around solutions. Our next speaker, one before the last, is another rabbi, and that's Rabbi Mikey Goldstein, who is the president of the Rabbinical Assembly of Israel and the rabbi of Adat Shalom Immanuel, which is a Masorti synagogue in Rehovot. I know Mikey for many, many years. It's really nice to see you again. You haven't changed since the 1990s when we worked on HIV/AIDS prevention together. And just to let you know that because we have a very hard stop at 4:30, we shall listen to your advices and your pitches, which we had wanted to listen to live through the communication channels that are available to you, and you can look at our folder. But I would like to invite you for your 8 minutes, Mikey, and I'll need to stop you if that's beyond that. Thank you.
Thank you very much, Dr. Shinkar, for the invitation and for arranging this very interesting seminar today. Okay, now I have to learn how to use this as well. Great. So just first of all, a few words about who I am. So first of all, I'm the rabbi of Adat Shalom Immanuel, a conservative Masorti synagogue. I'll get to what that means in a moment, what type of Judaism we are. But basically, my full-time job is running a synagogue and looking after our congregants. I'm also the president of the Rabbinical Assembly, which is in Israel, which is the organization of conservative Masorti rabbis, the Israel region of that, and we're part of the larger Rabbinical Assembly of the whole world. And finally, I'm also representing the Masorti movement, which is the movement of conservative Judaism here in Israel. And what makes us different from Orthodox and Reform is that we see ourselves, whilst we see ourselves as being traditional, but we also think that change is something natural within Judaism, which we feel that in certain parts of Orthodoxy has stopped because Reform came and changed too much. But we won't get into that today. But basically, we're somewhere in the middle. So as the rabbi of a synagogue, of which we have about 100 member families and about another 100 families around who consider themselves members but forgot to pay membership, I need a guiding light in all this COVID stuff. It's like, what do I do? How do I talk to the synagogue board that is the decision maker for the synagogue? And you know, what religious ideals and ideas can I bring in to our decision making? And so my leading light for COVID has been the verse from Deuteronomy, "V'nishmartem ma'od lenafshotechem," that you should look after yourselves for your own sake, therefore be most careful, is the JPS translation. And whilst this verse talks about something else, but as typically Jewish ways of interpretation does through Midrash, is that it takes it slightly out of context in order to help us understand. And so it is used by the rabbis to teach us that we have to look after ourselves in all sorts of ways, and especially in a medical way. And so with that in mind, whenever we need to make a decision, especially around COVID issues, so I use that. How are we looking after ourselves? How am I safeguarding our worshippers? And to safeguard our worshippers is not just a case of put your mask on. As I see not everyone here is covering their nose and mouth. And in fact, in my synagogue, even anyone who is leading a service or talking, even the bar and bat mitzvah boys and girls who read from the Torah must all wear a mask the whole time. How do I safeguard not just the physical well-being that people don't catch COVID, but how do I make sure that those who are still at home because they're still too frightened to come out even when they're triply vaccinated, how do I look after them, their emotional well-being? How do I look after their religious well-being? If they're not coming to synagogue, then how can I help ensure that they can still fulfill their need to pray, whether that's a need of 3 times a day or whether that's just a need of once a week? It doesn't matter where the person is. It's my job to help them. And we were perhaps one of the first synagogues in Rehovot, the city that I'm from, that closed our doors about a week after the Purim festival in 2020, before any lockdown came into effect. And that's a really difficult thing to do. Should we close already? We haven't been told that we have to close our doors. V'nishmartem od lenafshotechem, that you must look after your well-being, meant that we decided a week or two before the rest of the country to close our doors. And what's it mean if we close our doors? It means we don't have our regular services. And we just do, in general, Shabbat and holiday services. So it meant that we weren't meeting. And so how do I get to people? How can I ensure that people can still pray when they would normally come to us? And because we are traditional and we don't use technology on Shabbat, we had to find ways of nevertheless having some service before Shabbat and then after Shabbat. So we would do the Kabbalat Shabbat service, the parts that you can do that aren't, that can be done before Shabbat, basically. And the first number of weeks, especially when we were in full lockdown, we had 30, 40 people, 40 Zoom squares, which is even more people. Often there were 2 or 3 people connecting. And at some point we would go into little Zoom rooms so we could talk to each other, see how we're doing. But it's interesting, after about 5-6 weeks, the numbers obviously started to drop off. And that's something, again, how do you deal with Zoom fatigue? How do you still reach people, ensure that they can pray? And so one of the things we did was we loaned our, for people who wanted our specific prayer book, they were able to come and collect a copy of the prayer book. Another thing that we instituted that we didn't have beforehand, we didn't used to pray at the end of Shabbat, the evening service and Havdalah. We didn't have that in our synagogue, but we started doing it on Zoom. And amazingly, that is something that continues until today. I said that as long as we get the quorum of 10 people, then we'll continue. And then each week we get 15 to 20 people, and here's me performing the Havdalah, the separation service after Shabbat. You can see some of the people watching up ahead. But COVID also has allowed us to introduce new things that we weren't doing beforehand and reach more people. When we were back at synagogue, we were all back with masks after the first lockdown until today. And how do you interact with people when you can only use your eyes, right? Besides, obviously, your voices. But normally, you look at somebody's face, you can see where they are. And so here I am with a bar mitzvah kid, but it's really, you know, looking into the eyes of people, it's changed how perhaps we interact with each other. We also used our beautiful garden that we have for people to meet. They couldn't meet in their homes, but they could meet outside. So we allowed members to book space in our gardens. One of the most important things that my synagogue did was for Yom Kippur 2020, we introduced a live stream of all our services, one that would work on Shabbat when we normally wouldn't use technology, but because it's something that operates actually 24/7, no one needed to touch it, and we made sure that people knew, if that was important to them, how to ensure that it was operating already before Shabbat or before Yom Kippur. And over 6,000 people watched in 2020 on Yom Kippur, over 5,000 this year, and every Shabbat we get between 150 to 200 people who tune in for our Friday night or Shabbat morning services. And just more pictures because I love our live stream. And perhaps I'll end up here, Purim a year later. We're working on how can we have as many people. Safeguarding our worshippers also means that people who perhaps aren't fully vaccinated can still pray. And so at some point we'll be using inside and outside. Here you can see some people sitting outside the synagogue. There's a pergola right off the main sanctuary, and we open up the doors so people are almost part of the same space. But people who are outside, either they don't want to be inside at all, or they aren't fully vaccinated and they couldn't be. But we have to make sure that everybody, or as many people as possible, even though we have turned some people away because they didn't have the right test. For certain services, you needed to have Green Pass. But for others, you don't, so people had the different opportunities to join in different ways. And so we're trying, as much as we can, to look after our worshippers in as many ways as possible.
Thank you very much, Rabbi Goldstein. It's really been, wow, an amazing day today, and we are coming to our inspirational last speaker, who is another chief rabbi, that's Rabbi David Rosen, who is the American Jewish Committee International Director of Interreligious Affairs, was the former chief rabbi of Ireland, almost does not need any introduction to an Israeli audience, but definitely to our many viewers around the world. I want to assure you that those of you who have already contacted us about the bios of the different speakers, those of you who are watching around the world, they will be available to you. Thank you all for those who have registered on our online viewing. And we give the last words to Rabbi Rosen. I'm sure that they will be remembered not only for themselves, but also in the context of all that we have heard today. Thank you, David, for talking to us.
Thank you, Dr. Shenkar. I have a lot of problem with that build-up, especially as basically what is bad news for me is good news for you all. After all the wonderful things we've heard, and from many rabbis, one of whom is no longer with us, but basically said almost everything I was going to say, and did it with a great deal of inspiration, there is very little left for me to add. So the good news is that I will be brief. But at least allow me to reinforce some of the things that were said very briefly. Dr. Rutstein mentioned how the COVID-19 pandemic has highlighted our interdependence. Even if we would have wanted to, and we shouldn't have wanted to, we can no longer live in isolation of one another. We are inextricably intertwined with one another. And what takes place in one part of the world inevitably affects the other. And this has been dramatically demonstrated. But COVID has highlighted, as also has been indicated, our mutual responsibility. Not only are we affected by one another, we cannot ignore our mutual responsibility, our care, our obligations towards one another. In Rabbi Professor Steinberg's presentation, he referred to the text in Leviticus 19, verse 16. You shall not stand idly by when your brother's blood is spilt, which Jewish tradition understands to mean that when anybody is in danger, you have the responsibility to do everything you can to protect an individual who is threatened. Today, that's a global imperative. But there is a verse 2 sentences earlier, which Judaism understands quite more extensively than its literal meaning, which is, you shall not put a stumbling block in front of the blind. Judaism understands that to mean that you have to ensure that people are in full command, not only of the physical reality, but also of the psychological, mental reality. In other words, they have to be fully informed. If you are not giving people full information, then you are complicit in whatever happens to them. Therefore, the imperatives for religion are dramatic. And of course, as Dr. Schenker mentioned in his introduction, first and foremost for our religious communities, and has been reiterated, also Archbishop Aristarchos mentioned it, that we are obliged to love our neighbors ourselves. Our religions affirm every human being is created in a divine image. Any act of irresponsibility towards another is ultimately an act of responsibility towards the Creator himself. And indeed, the Maharal of Prague, the great 17th century luminary, says, love of God means love of his creatures. Anybody who does not love all God's creatures does not truly love God. And therefore, the responsibility that we are engaged in is the imperative of religion itself. It is at the very foundation of religion. Finally, what I think the third point I would like to mention that COVID has highlighted is one that is at the heart of this initiative and has been referred to. And that is the unique relationship between science and religion. Not only are science and religion not opponents, they have a mutual obligation to cooperate, and that's the significance of this remarkable initiative, something that is not obvious to everyone. We've heard very important statements that our religions affirm the obligation to take science very seriously and to get the guidelines from the medical experts. But science needs religion too. Science needs religion in very practical ways. Religion is the delivery system. An organization of which I'm one of its presidents is the largest world interfaith body called Religions for Peace, received a number of years ago at the height of the AIDS pandemic, received a large amount of money, quite a few $1 million, from the Gates Foundation. For what? To work with AIDS orphans. Why should the Gates Foundation have given all that money to a religious interfaith organization? Because religion is the delivery system. It's through the mosques and the church that you get it to the masses, as no one else does. And indeed, the vast majority of social and philanthropic organizations in the world are religiously inspired and motivated organizations. Science, when it fails to engage the religious institutions, fails itself. It betrays its métier, its goal. And therefore, in practical terms, the cooperation with religion is an imperative. But also, science needs religion for education, as we have already heard, to educate the communities about what are the real possibilities and what are the real dangers. And we've heard a lot referred to here about the fake news and conspiracy theories. All of us know somebody, one or other, who is affected by that. And it's precisely through the spiritual guidance and leadership that we can convey the reality, the truth, the information, the scientific facts. There is, of course, if we refer to the pandemic in literature, one of the most wonderful psalms, of course, that in Judaism we recite it very continuously, and that's Psalm 91, which talks in many places about the dangers of plague and of pestilence, and of how faith in God can enable us to at least triumph over that. At least our faith, we pray that God will protect us. There's one phrase that says, "Lo tuneh elecha ra'av v'nega lo yikrav ba'olecha." No evil shall befall you, nor shall any plague come into your tent. it seems a little superfluous. If no evil is befalling you, then obviously no plague or any negative thing is going to come into your tent. But not everybody's motive is necessarily negative. There are people who are spreading information who genuinely believe that they are doing a service. And therefore what we have to do is we have to take this seriously. We have to ensure that even when the motives are not ra'ah, are not evil, there still we have to work to ensure that nega lo ikrava olecha, that no plague comes into your tents. And we have to work, therefore, respectfully with those who may have the highest motives, the best motives, to ensure that the data and the information is transmitted effectively. Finally, this initiative offers the opportunity for us, as representatives of our religious traditions, to work together. That's no small thing. Throughout history, we have been competitors, to our own detriment and to the detriment of civilization. Here is a great opportunity for us to show the most sublime, noble values of our respective religious traditions and the fundamental human values that we share, that bind us together. And in so doing, we sanctify the divine name. We perform a Kiddush Hashem in the world and ensure that religion is seen by the world as a blessing for all humankind. Thank you.
I will be very minimal in order to leave you with those very important messages we've just heard that conclude a couple of good hours of a lot of things to digest. There is some more refreshments waiting for you as you walk back to your home to have the opportunity to interact still and reflect on what we have heard. Profoundly thank you again to the organizing committee and to all of you who have come and shared the time here in Jerusalem. The Jerusalem Impact Vaccination Initiative is not a closed one. It's actually an open one. It embraces anyone who would like to join. You have all the information in your folders. And for those of you who are viewing from around the world, under the YouTube address, there is the contact information for us. I wish you all safe journeys back home, and let's pray that we can throw this away. And this was even a rhyme. All the best to you. Shalom from Jerusalem.